This month is National Epilepsy Awareness Month. Epilepsy, a neurological disorder that can affect anyone, regardless of race, age, or gender. And right now, roughly 3.5 million people in the U.S. have epilepsy, including children. Joining me now is Dr. Christine Tangredi. She's a pediatric neurologist with Novant Health. Thank you for coming in to talk about this.
Thank you for having me.
There's been a lot of interest. I've seen some emails and some national stories on this as well. So let's tell folks exactly how this affects the brain first.
Sure. Well, thanks for having me. Yeah, so when we use the term epilepsy, it can also be used synonymously with seizure disorder, and that basically describes seizures. So people afflicted with epilepsy have these unprovoked random seizures. And what a seizure is an abnormal electrical discharge in the brain. So the brain is supposed to be processing information, forming memories, forming speech and language, developing. And when you have these abnormal electrical discharges, you're not going to be functioning well in the brain and normal and healthy. So that's why it's so important to treat epilepsy so that the brain can continue to function normally.
And you have a personal interest in this?
I do. I actually started having seizures when I was in high school, about 15 years old. I would just stare off mid-sentence, and I noticed my body would jerk in the morning. Maybe if I was a little tired or sleep deprived. Finally got to my parents, they took me to a neurologist, and you know, there was like good and bad about that, and struggled a little bit. And I think I wanted to become a child neurologist, maybe to change the way that was done a little bit. And went to med school, became a child neurologist, and we're a close, small group.
Sure.
There's not many of us. And so over my lifetime, I've treated thousands of children with epilepsy, loved every one of them, and you know, it's kind of a blessing in disguise.
I'm sure they appreciate it as well because you have such a direct connection to it. When you talked about the seizures you had as a teenager, what kind of stuck out to me was they were subtle. I think a lot of people think seizures are a little more aggressive, or you know,
Yeah.
they look violent at times. I don't know if that's the right word to use, but yours were subtle.
Right. Seizures can look different in different ages. Like an infant might just look like they're stretching or blinking their eyes.
Wow.
An adolescent might just stare. People could have what we call automatisms, smacking of their lips, arm dystonia, and then the typical seizure is the violent one that people talk about, where you fall down and convulse.
That is what first thing I thought, you
Right.
know, so this is really interesting to me as well. How do you treat seizures?
So seizures can be treated in a variety of ways, thankfully. We have a variety of medications, and they're coming out with newer medications each year with less side effects. For people who don't respond well to medications, there are special diets like the ketogenic diet, a very high fat, low carbohydrate diet. There are devices that are actually surgically implanted in the chest called a vagal nerve stimulator that delivers a current to the brain, and then you're armed with an actual magnet to swipe the chest to stop a seizure. And then if seizures are really severe, you can actually go and surgically remove the seizure focus in the brain.
Wow, so a lot of different treatments, I guess, depending on the severity and
Correct.
your symptoms and everything.
Correct.
All right, well, thank you for sharing your personal
Thank you.
story as well.
Thank you.
Appreciate you coming in.
Thank you.